Good morning or good afternoon, everyone, and welcome to Health Tech Austin's Disrupt Diabetes Summit, which also coincides with Diabetes Awareness Month here in the United States. My name is Chris Finberg, and I'll be giving the opening remarks, along with being a moderator for our first panel discussions on innovations in diabetes care, followed by a separate panel discussions on diabetes toll in minority communities. Now, for my opening remarks, I want to share a few slides, and hopefully we can punch that up here real quick. Wonderful. So real quick here, I am the innovation director for a center that is funded by the National Science Foundation, technically an engineering research center, and it's called PAS Up. And PAS Up is a very long acronym, Precise Advanced Technologies, Health Systems for the Underserved Populations. And what we're trying to do here at the center is really change the paradigm for these chronic diseases with the focus on the underserved populations here in the United States. Part of the center, we have four major institutions: Texas A&M, UCLA, Rice, and Florida National. So we have all of our various researchers and students working with the various projects and programs within the center. And what we're trying to do here in response to this grand challenge of tackling these chronic diseases, especially in diabetes space, is trying to develop these new and innovative technologies. As you can see here on the top here, some of our major engineering goals, the lab on the palm system and the lab on the wrist system, to really try to impact our underserved communities with these technologies. But that's not the entire story. We also have a major research area that is focused on getting into those communities, understanding those workflow gaps, those disparities, those inequities, so that when we apply these new technologies with help from our innovation partners towards commercialization, that these new pieces of technologies can be effective, produce the greatest amount of impact to these underserved communities in the urban and rural areas to hopefully improve the quality of life. I first want to start by acknowledging here that COVID-19 has been lethal for Americans with diabetes. COVID-19 has really shown the light on what diabetes has done to people with this disease with COVID. But that's not the entire story. The real story here is that in the US, we've been losing the battle against diabetes for the past decade. If you measure this per deaths for diabetes, we have not moved the needle, despite the billions of dollars and all the efforts that we have tried to tackle this disease. COVID-19 showed up and just shone a great spotlight on what really was happening on the ground. This next slide here is actually from a paper of one of our scientific advisors of the center, Dr. David Kerr. And the title of his paper was "Diabetes, like COVID-19, is a wicked problem." Diabetes is not tame. Often changing requirements, absence of equity, multiple and even selfish stakeholders, large economic burdens, and the ripple effects that go across economic and social. I think in America, we are fascinated by the home run, the big solution. But because diabetes is a wicked problem, it really cannot be solved. It can only be resolved. And I think that's what's great about this type of summit. What are those solutions? What are those ideas that we can take against this wicked problem of diabetes? This next slide here shows really a microcosm of inequities of diabetes in the US. And this is in particular of our nation's capital here in Washington, DC. And I want to highlight here 4 of the wards within the nation's capital. Wards 2 and 4, which are rather affluent neighborhoods, high white populations, lots of pharmacies, lots of grocery stores. But then, just a stone's throw across, you got wards 7 and 8, higher Black populations, less access to pharmacies, less access to grocery stores. I could keep going on and on and on. But if you look at the actual chart itself, you see the disparities in obesity between wards 2 and 6, and then 7 and 8, almost a doubling of obesity. Type 2, again, almost a doubling. And then, which really shocked me, was home internet access is almost a third less between wards 8 and 2. This is shocking. They're just right next to each other, but yet here it is. And this is just an example of really disparities that are happening across the United States. And simply COVID-19 just further shone a light on what's really going on. Finally, I want to leave ourselves with maybe a positive note here. This particular scientific article came out in 2020, and I titled this slide, "Can you prescribe walking?" As you can see here, some of these results, if this was a drug, a pill, this would be a multi-billion-dollar pill. Can you imagine, by just walking, you can reduce your risk of any sort of mortality by 65% if you're 65 or older. This is shocking, but this is something that all of us can do. This is maybe part of that, one of those solutions to diabetes, one of those behavioral changes we can all try to do. This is an amazing statistic, and hopefully something all of us can take to heart and maybe spread the word as well.